Welcome to the CPA's Prescribing Companion app. This is a core repository of prescribing resources for human and animal health to help prescribers support the drive for better use of antimicrobials. It has been co-created with our partners in 22 countries across Africa and Southeast Asia in collaboration with Tactum, the developer, as part of our SPARK programme. The SPARK programme aims to help healthcare providers build capacity and resilience in antimicrobial stewardship in their local healthcare systems.
We have designed the app so that users can access national standard treatment guidelines offline and at the point of care. You can also access guidelines from other countries on the app. Access resources on antimicrobial stewardship and infection prevention and control. This is a collection of international resources such as WHO and CDC to help raise awareness of this work. Together, this helps to foster a One Health approach, strengthening AMS across human and animal health, learn from best practice and improve multidisciplinary collaboration and shared learning. The app is also very customizable, and further standard treatment guidelines can be added beyond AMU and AMS, which we'll present later.
This helped build strong country ownership with an adaptable app to in-country needs. We are working with app champions in each country, providing training and funding to drive the rollout and ensure sustainability. We will now move on to navigating the app. To get started, first download the Prescribing Companion from either the Google Play Store or the Apple iOS Store. We also have a website version which mirrors the app and has the same functionality. Once you've downloaded, just accept the terms and conditions of the disclaimer to continue. At the home page, you can navigate through different country toolkits and select the toolkit you want to download. You can download a toolkit from any country. This will now be available for you to use offline without any internet connection going forwards. For this demonstration, let's go into the Uganda toolkit and navigate through the different sections. There are 6 sections. These are similar for each country's toolkit. Firstly, infections and infectious diseases prescribing, where the standard treatment guidelines are located. Next, we move on to other and common clinical conditions, customizable for countries. After that, we can look at international AMS and infection prevention and control. Tab 4 leads us to COVID-19 toolkits with international and country-specific guidelines. At tab 5, we look at animal health with international and country-specific guidelines where they're available. Finally, tab 6 brings us to intervention recording. This is a fully customizable tab to in-country needs. Let's take a more detailed look at one of the sections. Infections and infectious diseases. This is where the national standard antimicrobial treatment guidelines are located, and as you can see, we present them in a body system structure. These guidelines will look familiar to you as they reflect the published guidelines within your country. To use them, if you, for instance, wanted to treat pneumonia in Uganda, you can simply open the Uganda 2016 guidelines hosted under this section. Click Respiratory Diseases, tap Pneumonia, and select the age group of your patient. You can then cross-reference with the treatment options listed. Having access to these guidelines offline and at the point of care will help to improve good prescribing practice amongst healthcare practitioners who use the app. Similarly, where available, national animal health prescribing resources have been added and can be accessed under the Animal Health node. International resources available for animal health include the FAO Action Plan on Antimicrobial Resistance 21 to 25 and AMR Hub to support veterinarians. This is one of the first of its kind. There are also a number of resources hosted in the International AMS IPC section. Here you can find links to the WHO Essential List of Anti-Infectives, stewardship tools and other IPC assessment and guidance documents, as well as certified training. You can also access some of the CPA tools and resources, such as the AMS Game, our CPD platform, and more in the Resources tab. The COVID-19 section has a number of guidances available from international agencies as well as links to local in-country guidance, usually presented from the Ministry of Health portals. To allow for full adaptation of in-country requirements, the Other Common Clinical Conditions section is fully customisable. Here, countries can add guidelines and resources in other therapeutic areas, for instance hypertension, diabetes, or any other pharmacological area. Finally, the Intervention Recording section is an area that can be customised again by countries to collect a vast range of data that support AMS activities, for instance surveys or audit tools. To start with, the Spark team has added an audit form to identify the range of interventions made by health professionals as a result of using the app. We encourage users to complete this to help further develop the app in the future.
The CPA will continue working with the app champions in each country to continue developing and maintaining the app. Thank you for taking the time to learn more about the Prescribing Companion app. Our FAQs and more information about the development of the app are available on our website. Please feel free to email us for any inquiries.